You brought up another point earlier, Dr. Pal, which is around family history and how we don't
Correct.
know as much
Exactly.
about it in India.
Mm.
I think that, we didn't worry as much about the cause of death
Before.
before.
Ah. Ah.
Um, and people, lived a good, happy life.
Mm.
And if they got any of the conditions late, we actually, talked about it as stomach pain
Ah.
or dementia.
Exactly.
We really didn't go down to the level of diagnosis and treatment as much as is today.
So we accepted
That's
the
right.
cause of death as a part of aging.
Exactly.
Ah.
And I think that is who we are culturally, right?
Mm.
And we didn't ask too many questions
Correct.
around the exact nature.
Correct.
Therefore, if you ask our parents' generation how their parents passed away, they may not actually know the exact cause of death. I still remember having this conversation with my father, who had a shoulder issue,
Mm.
right? That turns out to be genetic. And when he found out about it, he said, "Oh yes, now I remember that my father struggled to put on, his t-shirt,
Mm.
right? Struggled to raise his arms above his head. But we never diagnosed those with MRIs
Ah.
and understood what was happening to the shoulder and the muscles. And therefore, I think that this generation has changed. We are now beginning to understand what some of the causes of death are and the chronic conditions that our parents have. Therefore, the generation of people in the 40s and the 50s now have a better understanding. And this is a wake-up call for those in their 20s and their 30s, because they actually do know.
Correct.
Right?
Correct.
So if you have diabetes, hypertension, cancers, sudden cardiac deaths in the family, please take this seriously.
Mm.
This is actually increases your risk of many of these conditions multifold
Absolutely.
over somebody who doesn't.
There's a small thing is even family history of diabetes
Yes.
puts you at an increased risk of diabetes
Yes.
if you are not, metabolically active.
That's correct.
So I've seen many of my colleagues and my friends who being a diabetic is extremely common these days in the parent
Yes.
population. The concept of the increased risk has not imbibed or ingrained in subconscious mind, where the lifestyle choices continue to be poor.
Yes.
So I think the awareness that, okay, so I'm at an increased risk to start with, and then I want to make sure that everything is okay from my end, to make sure that what I can control from a personal aspect.
Yes.
So you talked about the decade specific screening, correct? So let's start from there. So let's start from 10 to 20. Okay, 10 to 20, men and women, boys and girls. So we talked about HPV vaccine for girls around 10, 11, 12. And then for boys, probably not that much.
Not that much. I think they have growth spurts. And as a result of sometimes, growth spurts, there might be associated concerns around, fainting, dizziness, hormones. Some of those things start to come into play, right? And important for us to take cognizance of what may be going on and be supportive through that. I think if we come back to girls a little bit, hormones are a very important part of a number of chronic conditions later, right? We don't think about hormones as much. Yes, excess carbs is a factor, but hormonal imbalance actually puts women at risk, at a very different level of risk. And that starts in this puberty age, right? And therefore, there might be concerns around the regularity of menstruation, when it starts, and therefore making sure that hormones, iron levels, all of this is actually taken care of for women and girls in sort of this 10 to about 14 age group.